So a very warm good afternoon and Subhakanshlu Vizag, and thank you so very much Dr. Raman Raju sir and Dr. Madhu Duraju for giving me this opportunity. And on the behalf of the big guns of AIOS, I would like to take this liberty on the behalf of ex-President Dr. Ajit Babu Maji, our Honorable the Secretary and the Treasurer, Dr. Madhukar Reddy and Dr. Nankishore sir, that we are wholeheartedly supporting Madhu's cause in his first step towards a journey in the AIOS. Now coming to my talk, so it's on collagen. So previously it was known as Ologen, and company has been taken over by Dr. Jagdeep M. Kakadia and Dr. R.C. Shah. And I have no financial interest. So these trap, we are regularly using mitomycin C, and it is not free of the side effects. So the bleb thinning is there, we can see. Melting is there along with blebitis and endophthalmitis. And flat bleb. So there is this collagen that is the type 1 fibrillar collagen obtained from the bovine tenons tissue, and which is completely acellularized and is totally de-antigenized, so it doesn't causes any reaction. Therefore, it retards or suppresses the fibroblast activation and maturation into fibromyocytes, and it helps to negate the subconjunctival scarring. Also, it induces and promotes the conjunctival lymphatics, regeneration, recanalization, and reanastomosis. So we can see the main cause of the failed trap is because of the ring of the steel scarring formation, because of the abundance of the fibroblasts. So this collagen has holes of 20 to 200 microns. So the fibroblasts, they grow around it. That's why there is a continuous drainage. And there is a ever-filtering bleb. So this, you can see mitomycin C only bleb flattened, and the thinning is also there after 12 months of post-op. Whereas when we have combined it with collagen, so it's a very healthy bleb. And MMC is needed to prevent the scleral fibroblast activation. There are a lot of studies in PubMed. So this is the collagen. Its thickness is 200 microns. It's not moving. It's not moving ahead. Yeah. So this is how it is placed. After doing a routine trap, impregnated with BSS, cutting into 2 pieces. So either 1 or 2 depending on the IOP, and then suturing it. And you can see, so the IOP of 12 mm of Hg in one of the case without any topical or the oral anti-glaucoma medications. And there are, you can see, these are the extra lymphatics that has been formed. So this bleb is ever filtering because there is no chance of the ring of steel scarring formation. So it's a well-formed bleb. It's again not moving. Yeah. So the best success is achieved when the glaucoma is primary and when the conjunctiva is not fibrosed with sclera. So till now, 300 plus cases, 3 surgeons, 6-year results, and the age is between 20 to 80 years. So flat and healthy, naturally vascularized bleb in all the eyes. IOP came down from even 60 to 70 millimeter of Hg to the mid-teens, and it remained around 12 to 18 millimeter of Hg without any medication in most of the cases. And this post-op IOP, because these are the extra lymphatics which are draining into the thoracic duct. So it depends on the thoracic duct pressure, which is slightly or moderately high in cases of gross obesity, high uncontrolled hypertensive, the pulmonary hypertensive patient, and the tricuspid valve regurgitation, and very high blood lipids. So in such cases, we can use the anti-glaucoma medication, and it reduces the IOP into the range of teens. There are other uses of collagen. It can be implanted as the cover patch for the tube shunts instead of donor cornea or the donor sclera, and as a support and tissue healer for scleral melting after pterygium surgery. And the hyperfiltering Bleb revision, again it can be used. The Murone ulcer melting and perforation, again it can be used, and as a cover patch for the exposed cortex in case of the SFIL implantation. So there are multiple use, and a patch graft in the cases of scleromalacia perforans. In cases of necrotizing scleritis, cornea is not needed, we can use this. And we are waiting for the Indian FDA, that is CDSCO, for the final approval. And thank you so very much, and hoping for kindly pour your blessings for my journey in AIOS as ARC South. Thank you so very much. And I'm happy to take any questions.
Dr. Kakadia? Yes, sir. Yeah. Is it commercially available?
Yes, very soon it will be commercially available. We are waiting for the clinical trials are over now. Okay. So the CDSCO final, we are waiting for the approval. Okay. It will be commercially available, 8,000 plus GST.
Okay. Is it biodegradable or it persists for
It's biodegradable. Okay. Biodegradable, 100% biodegradable.
Right. Okay. Good job.
Yeah.
We used to have this product from an European company, no? And now it has been taken over, you said, by...
Yeah, taken over by the company of Dr. R.C. Shah and Dr. Jagdeep M. Kakadia.
Very good initiative, because we were missing it after the COVID time. Until then, we were doing this regularly, and it gave very good results.
Yes, one of my PG way back did his thesis on this Cologen. So they have changed the name Cologen, it's the same thing. Success rate in that thesis, it was 90%, and in 300 cases.
So trap with MMC and trap with only Cologen.
Yes. So if you see that the IOP is too much, it's above 50 millimeter of Hg, then we are routinely using mitomycin C, and after only that we are putting this collagen. But if the IOP is less, 45 around, so without MMC it works very well. Especially in cases of Axenfeld-Rieger syndrome, the Bophthalmos cases, it works very well.
My experience with Cologen was with MMC or with Cologen. I didn't use MMC plus Cologen in any of the cases, and the results were comparable with less complications.
Yes, of course. Because in Bophthalmos, we need to avoid mitomycin C, because there is already an element of this scleral thinning.
I have seen a case of conjunctival erosion with Cologen, not with Cologen. Did you ever see any complications with Cologen like that?
No, there is no complication. It's de-antigenized, so there is it's acellular structure, so there is no complication. No. Thank you so very much.
Dr. Vishnuvardhan sir, please felicitate Dr. Arvind Morya sir. The panelists also can join. Chairpersons, please wait, sir. Two more topics also there for discussion.